too.
Hi.
Hey, welcome back. How's your ankle?
That's why I wore shorts, to show you the swelling went down.
Okay.
But I just lay down all day long, or either in a recliner or on a mattress. I don't walk around unless I have to. So, these are real tight. My hamstrings are real tight.
Yeah.
I need a referral again for physical therapy. Mine expired. I was down in Uruguay in South America.
When?
I just came back from there.
Oh.
Yeah. I applied for asylum and humanitarian protection and was granted temporary status, but I have to have surgery on the shoulder.
Okay.
So I had to come back because my medical insurance was canceled.
Physical therapy for which one? For the back, he said?
Physical therapy for my shoulder, this shoulder.
For your shoulder?
Yeah.
Okay. And Dr. Stember had also referred you for your back. Is that right?
I don't know.
I'll do whichever one you want.
I need a referral for physical therapy for my shoulder.
You got it.
I need a referral for the neurologist because this hand's not working properly anymore.
Yes, you saw the neurologist in July. You don't even need a referral.
I outlined. Well, no, I do. Look, I outlined with a marker to show you the swelling here as opposed to this one. You see the difference? And this thumb doesn't work properly anymore. I wake up, and at nighttime I wake up and my hands are in convulsions, ears ringing, head and ears and pulsating pain. That's 24 hours a day. But at night when I wake up, my hands are swollen, and they're in convulsions. They're convulsing, both of the hands and fingers. Right worse than left. As you can see, the swelling in this one is far worse than in this one.
And so you marked the area?
Yeah, I just wanted to show you where the swelling was worse in this hand as opposed. So I need to see a neurologist for that. That's it, I guess.
Okay. Let me get this all in.
Same other thing. All the rest of the other stuff's happening.
Okay.
I don't understand why people, the others in Cuba were able to get medical help, and everybody believes them that they were attacked by directed energy. But I was in Cuba. I have medical evidence to back up my injuries, and nobody wants to hear my story. I don't understand that. I was attacked with directed energy in Cuba.
What was your job there?
I was arrested at the airport by the Cuban police in Cuba.
Were you working at the embassy, or what were you?
No, I was doing something else. But the point is that they found a book in my suitcase, and they arrested me for the book because it was from a friend. He was assassinated 3 weeks ago in his apartment. He was killed. His name is Dr. Robert Duncan. He's a former scientist for the neuroscientist for CIA and Department of Defense and Department of Justice. Government contractor. He's dead. His name's Dr. Robert Duncan.
I just put in the, sorry to change the subject here, but I just put in the referral. You already had x-rays in May, so I think they will just accept this referral straight
For my
out.
hands?
For your shoulder. All right.
Yeah.
For the neurologist, they only need a new referral if you have not been seen within 2 years. You saw Dr. Stember, the neurologist, on July 8th, 2024. I know this was for a different reason, right? This is for your back and your foot drop, but your referral is still good. I'll show you right now. Okay,
I can just go make an appointment?
I will give you a copy of this too. If
Okay.
Okay. So here's your neurology referral. See that? Neurology outpatient.
Yeah.
All right. And so I'll just give you a copy of this so you have it for your records. Okay. But if they say, "Where's your referral?" just show them that this is it. Okay. What's going on with the dentist?
Trying to get. I need some more. I need some more lorazepam.
Okay. Did you already get some of the work done?
No, I went to the dentist, but I didn't. She decided not to do any work, so I got to go back, and then she got to extend me because I was in Uruguay.
Okay.
I was in Brazil and then Uruguay.
Okay.
So,
So, these 28 tablets of lorazepam, the reason I ask is because this is a controlled substance, so I can't give you a whole lot of it.
This is the man that was killed. He is a friend of mine, CIA scientist. He's on the Discovery Channel here. He was my friend. We were friends.
I'm so sorry.
He was killed 3 weeks ago in his apartment in Boise, Idaho by a pulse of energy. So he's dead. There's Jesse Ventura interviewing him. His name is Dr. Robert Duncan. He was a good man.
I do apologize.
This is the book that they found. When they found his book in my suitcase, the Cuban police arrested me in the airport. So the point is, I have evidence of being in Cuba, and I was attacked with directed energy in Cuba. I have medical evidence of damage to my ears from the directed energy attacks in Cuba. I don't see why this is an issue. And the reason I'm bringing it all up is because I need to see a neurologist to see if I have any. The ear doctor said that this was inner ear damage, the cochlea, the inner ear, not the middle ear or the outer ear. And she said you might have brain damage. And this was the ear doctor in Central America, and the ear doctor in South America also saw me, and both of them gave me I've shown you the videos, but the point is, they were from the University of Florida. She was from the University of Florida, but she was living in.
So I've got this all in for you. Was there anything else you needed me to do?
So I need to see if the damage to my ears is more extensive than just the cochlea. She said that I showed you the video. She said the hairs, the nerves in your ears are damaged, severely damaged. That's why everything is painfully distorted.
Have you seen an audiologist here?
Yeah, I've seen an audiologist in Kentucky.
Well, what about here? I mean,
No, I don't need to see another audiologist. Okay. And as a matter of fact, I have a whole story behind that, and I'm not too happy about it. I'll just leave it at that.
I'll just leave you this info. If you'd like to see an audiologist at the Manhattan VA, every department's a little different, right? So I understand why it's a little confusing to navigate. They don't take referrals here. You just call and schedule.
So what I'm trying to say is, because of the damage to my inner ear, my cochlea, I need to see if I have nerve damage. She said, brain damage. She said that's part of the brain. The inner ear is part of the brain, and she said you need to be checked to see if you have any further damage. So I need a referral for that, please.
What
and I'm headed back, and as soon as I get surgery, I'm headed back to Uruguay.
Okay. And you wanted to see a neurologist specifically, is that correct?
I have damage to both cochlea, okay, diagnosed by multiple doctors here in the States.
I got you. I'm just going to give you this info. Neurology, you already have a referral. Just go there, okay?
Go there, okay, all right.
I even printed, it just popped out of the printer in that room over there. I'm going to give you a copy of that referral slip, so you got it, okay? They saw you for a different reason a couple of months ago, but your referral is still good anyway.
Okay, so I can go to neurology, I can go to physical therapy, I already have. Oh, she said I need a new.
Physical therapy, you do need a new referral. You're right about that. I just put it in right now.
Well, I went there and tried to make the appointment multiple times, and there was always a problem.
Physical therapy in this hospital is very difficult. I get it. I just put in a new referral here. I gave you a copy of this.
So I said I'm going to try it one more time, and I'm going to give up.
Don't give up, okay? This is just VA stuff, okay? I'm printing out this. This is your referral to physical therapy. It's for the shoulder. They cancel the referrals pretty quick if you don't make it. So if you were gone for a little while, yes, you're correct. You need a new referral for that. Okay, so I know it's 3 different departments with 3 different policies. Neurology, you're good. Physical therapy, referrals in. Audiology, they don't take referrals. You just call.
Yeah, I won't go to audiology. Here, I've already been to an audiologist in America.
I'll give you the info. You'll have it just in case you want it.
I've already been to an audiologist in America, so it's not necessary to go to another one.
You got it.
But the lorazepam, I need that refilled.
So it's a controlled substance, so I just have to ask you, what happened to these 28 tablets?
I have like 3 left.
Okay. So you are getting dental care with them?
I went there,
okay,
and now I got to go back again, and she's going to have to extend me.
So you need more dental care done.
Yeah, but when I go into the in the dentist's office, I don't notice any difference in the anxiety.
Okay.
Even when I'm taking the lorazepam, I don't notice any major.
They are having you think about this for using lorazepam, potentially, essentially as a sedative. Okay.
This is what I need for my pain right here. That's what I need.
Oxy?
That's what I was taking. Yeah. That's what I need for my pain.
Okay.
And I need the lorazepam refill.
What pain? Why were they giving you oxy?
C3 is gone. The entire disc is gone. I have multiple herniations in my upper back, thoracic, and a lumbar. Two in my thoracic two in the lumbar, one in my thoracic,
Yeah.
T7 in my thoracic, L4, L5, L5S1 in my lumbar.
I got you. This is just
My,
a very old school way of treating chronic pain with an opiate.
And
I wouldn't suggest that personally.
also my tailbone's fractured.
Who are these doctors? Trang and Jang?
I don't know. I don't know how to pronounce their name.
Okay. Are these pain doctors, or what kind of doctors are these?
These are VA doctors.
Medicare at Walgreens, Walmart?
I see so many doctors. I don't
Sure.
remember.
I really can't touch narcotics here. I can give you some more lorazepam, but if you want chronic pain treatment, I can plug you into the pain clinic here. I will tell you in general that we've really tried to move away from giving narcotics just for chronic pain, right? Chronic meaning long-term pain. It should be paired with a variety of treatments.
Well, I have it. I have long-term chronic pain. You know
I got
that?
you.
Yeah,
I can refer you to the pain management clinic.
Sure.
And they will offer you a variety of treatments, not
Sure,
just
but
narcotics.
I'm just here to get surgery on my shoulder and leave.
Okay.
So, you know,
Do you want to just skip the narcotics thing for today? I'll
if
get you
you
lorazepam.
can't prescribe it, fine.
Okay. I'll get you some lorazepam. You can take a slightly higher dose. That dentist emailed me for clarification. Now,
I
she
remember
told-
taking 2 milligrams, and I think it was 2. I'm not sure.
Yes, I had given you 1 milligram tabs, and I think you ended up taking 2 at a time. Is that correct?
No, I've taken 2. I'm saying I've taken. I don't remember the dosage, but I think it was the tablet that I took before was 2 milligrams. Now I'm not sure. The single dose, each dose was 2 milligrams, I think. But I can tell you that when I go into the dentist's office, there is no decrease in anxiety because of
Yeah.
the lorazepam that I'm taking. It's
Well,
not.
I'll tell you exactly what it's not for anxiety, not in this case. The dentist told me, this is Dr. Tessami, this
Yeah.
dentist, okay? So they wanted to do sedation,
Yeah, I need sedation. Yeah.
okay?
They're gonna take the rest of my teeth out, and they're
Yeah.
gonna put in implants.
So lorazepam can be used as a sedative, basically.
It's not very sedative.
Afterwards, you just need to make sure, just be careful that, you could be a little drunk afterwards. Make sure no one takes advantage of you, Okay, so these are better if you pick them up. Is that okay? Can you pick them up at the pharmacy?
Yeah, sure, yeah.
Okay. All right.
Can I pick them up today, or do I have to wait?
Try. They close around now. Try, or just come back another day. But I'll sign this prescription for you right now, okay? And you picked things up at the window down there before, right?
Yeah.
Okay, so I'm giving you the maximum I can give you, which is 28 tablets of lorazepam, okay? Okay, and then I'm required to look at that thing with the controlled substances, so I just like to do it in front of you so you know exactly.
So this is the award, a letter of temporary asylum and humanitarian protection in Uruguay by the Uruguayan government.
Okay.
But I couldn't. My insurance was canceled, and so I had no medical insurance to pay for surgery, and I was forced to come back to the States for surgery.
Okay.
So,
So your plan is to stay there long term eventually?
to live there, yeah. If I get permanent residency, asylum, whatever.
Okay, prescriptions are in. I'm going to give you these notes, okay? You can choose when it is you want to come back and see me for your next checkup. Is there anything else I can address for you today?
That's it.
Okay, let me give you all these copies of the notes I took for you.
Thank you. If you ever want to Google him, his name is Dr. Robert Duncan. He was a good man.
I'm so sorry that you lost it.
He testified before Congress. he testified before the U.S. Senate about these atrocities that people are having happen to them all over the world, like the people in Cuba.
Let me give you these, okay?
I've lost a few friends. The
Let me
same.
just show you what I got here, okay?
Yeah.
You know, I take notes for you, okay? Any 2 days for you, right? You can schedule your next appointment with me or call later, whatever you like, okay? Neurology 7 West. If you've been seen within 2 years, your referral's still good. I'll give you their front desk extension because I've taken you late in the day. So if you need to call later, that's their direct extension, okay? That's the direct extension for audiology. Physical therapy, your referral's in. I'm giving you a copy. This here is the physical therapy consult, okay? See it right here, shoulder pain, and the department is physical medicine and rehab. Okay, this is a copy of your neurology referral. Okay, neurology.
This is the physical therapy referral behind it.
Yes, physical therapy, neurology. Okay, so you got copies of both.
So it's probably too late to go now.
It might be. Okay, you might want to try anyway, but
Yeah.
it might be. You might just have to call. I gave you the extensions and the numbers. Okay?
I have a pulmonary function test tomorrow that you scheduled, that you
Yes,
referred
sir.
me to.
Yes. Those results will be delivered to me. It usually takes them a week or two to fully interpret them.
I assume you'll find damage because of the attacks.
I'll look at it with you, okay?
Okay, thank you.
All right, my friend.